Hi everyone, my name is Anthony Servania and I'm an occupational therapy student from the University of Pacific. In collaboration with Move Up Health and Fitness, we bring you episode 4 of our YOPD series. Today we'll be talking about emotional regulation through exercise. And before we begin, I'd like to go over the disclaimer and safety notice. The following video is intended for general wellness and educational purposes only. It is not a substitute for medical advice, diagnosis, or individualized therapy. Always consult with your physician, occupational therapist, or healthcare provider before beginning any new exercise program, especially if you have a condition such as Parkinson's disease. This video is created by an occupational therapy student under the supervision of a licensed occupational therapist. All exercises have been reviewed and approved for general safety and appropriateness. Use caution when participating. Ensure your chair is stable and have a caregiver or support person nearby if needed. If at any time you feel dizzy, lightheaded, or experience pain, stop immediately and seek medical advice. By choosing to participate, you acknowledge that you're doing so voluntarily and at your own risk. Neither the creators of this video nor the supervising therapist are responsible for any injury or harm that may result. Now, to start things off, what are the psychological impacts of being diagnosed or experiencing YOPD? According to Pontone and Weiss in 2018, at least two-thirds of individuals will have clinically significant neuropsychiatric disorder during the course of the disease. This includes behavior changes such as anxiety, apathy, depression, fatigue, and sleeping disorders. Stevenson et al. In 2023 noted demoralization and loss of identity, while Klepak et al. In 2013 noted confusion, hallucination, and psychosis. As we can see from these many studies, living with Parkinson's can cause major impacts, but what can we do? Exercise, medication management, and sleep hygiene have been shown to improve psychological symptoms. In 2018, Chen noted that medication management has been seen to improve symptoms so long as anti-Parkinsonian medications are used at the minimum therapeutic dosage. Exercise and sleep go hand in hand, with exercises being shown to improve sleep quality and improve symptoms of depression. Additionally, Anderson and Shiva Kumar in 2013 noted an improvement of system response tolerance, while Bernstein and McNally in 2018 noted an improvement of coping benefits. Decreased anxiety and increased quality of life was noted by Beck et al. In 2020. While there are many different general guidelines, the most important is consistency. According to Anderson and Shiva Kumar in 2013, consistency is key regardless if you perform emotional regulation exercises daily or weekly. Other studies have noted different frequencies, such as Schutz et al. In 2022 recommending 3 times a week for 16 weeks, while Gabi et al. Recommends 2 times a week for 32 weeks. Regarding intensity, high intensity has been seen to provide the best results for improving sleep quality, according to Schutz et al. In 2022, and Martinez, Diaz, and Carrasco in 2021 has also noted that high intensity increases hypothalamic pituitary adrenal axis activation. This means improved stress management. Similarly, for the types of exercise, many different forms of exercises can be utilized, with Schutz et al. Noting that they utilize resistance and aerobic activities, while Gabi et al. Utilize functional mobility and mental/leisure training in order to provide results. As such, the exercises that I'll be showing you today are not the end all be all. Everyone's response to exercise will be different, and it's important for you to find out what works best for you and to develop that consistency with the activity to improve your emotional regulation techniques. With that being said, here are 3 exercises that I like to do which helps me emotionally regulate. The first activity that we'll be going over is the world's greatest stretch. The goal of the activity is to improve controlled breathing techniques and to improve your mobility. The videos on the right provide 2 variations, the lunge variation and the chair-seated variation. And meaningful activities include yoga and gardening. As with gardening, you may be in this position when you're picking up pots or moving around tools in the garden. The next exercise we'll be going over is the kettlebell swing. The goal of this exercise is to incorporate an explosive high-intensity exercise to improve lower body strength and core stability. The video on the right provides 2 different hip hinge variations, with the kettlebell swings being on the right and the cable cord variation of the deadlift being performed on the left. Meaningful activities include basketball and traveling. And finally, we'll be going over the cable chops. This is another high-intensity activity which aims to improve core mobility while focusing on the upper body. The videos on the left display 2 variations of the high to low chop, with the left video being the standing variation and the right video being the seated variation. Meaningful activities which include these skills include wood chopping for when you want to get wood for the fireplace and for when you want to push yourself out of bed. And with that, that concludes this week's video on emotional regulation for YOPD. Join us next week where we'll be talking about ways to double dip your exercises. As always, if you'd like to have a copy of our presentation or other resources, check out the Google Drive provided in the description. See you all next time.